broadcast. Thank you.
Thank you. Good morning, everybody, and a happy new year. And I think we need to say a healthy new year to everyone. So, welcome to everybody for the first meeting of 2023 for Health Scrutiny. And can I welcome anyone, please, on YouTube who are watching this meeting today? And a happy new year to them also. Right, so first of all, we've got the meetings of the last meeting, which was the 15th of November. Does anybody have any objections to approval of those? Councillor Welsh.
It's not an objection necessarily, but we approved the work programme in the last meeting, which included access to GP services, health visitors, and dentistry services that are no longer on this agenda. And I'm just wondering why that is and when they'll be put back on the agenda, given the urgency, particularly for the fact that I requested health visitors to be here and dentistry services are both two things that I personally requested at this meeting, and the fact that we were supposed to have an update with regards to access to GP services, and given the current climate, there's a matter of urgency regarding this. So we agreed it at the last meeting. It's not on the work programme now, and there's no explanation within this report as to why they're not on here.
Well, our officer will give an explanation, but when we had our pre-agenda meeting, both Vice Chairman and myself were told that various reports weren't here for one reason or another. And I feel under the current climate, I would rather see the administration people sorting beds out at NUH than trying to get reports here for us. And if it can't happen, it can't happen. But they will be on at a later date, and our officer will explain. But that was our explanation for the Vice Chairman and I agreeing to it being pulled on this meeting, plus the fact we had Christmas in between.
If it's okay, if I could just add, Councillor Welsh, that when we come to the work programme, I will elaborate on the points that you've made, and the minutes of the meeting are accurate in that what you're correct in what you say, that was agreed at the time. But we can have a substantive discussion on the work programme when that item comes up, if that's okay. Thank you.
Thank you. So apart from that, everybody's all right on the minutes. Thank you. Can we have apologies for absence, please?
Yeah, we've had apologies for absence from Councillor Martin for other council business, and Councillor Perdue Horan is substituting. Apologies from Councillor Wilmot, other council business, but no substitute. And Councillor McGrath with for other reasons, with Councillor Pringle substituting. And also apologies from Sarah Close from Health Watch.
Oh, thank you. I wondered where she was. Thank you. Well, welcome, Councillor Pringle. Welcome to this meeting. You seem to be at every meeting I'm at the moment. Super sub. Right, so we'll move on to the declarations of interest by members of officers. Do we have any, please, from anyone? I will give one myself because my daughter works at NUH. Have you to give out one?
Yeah. My husband's a community staff nurse.
Anybody else? No? Okay. So we'll move on to our one and only agenda item, which is consideration of the expansion of Newark Hospital. Now, for me, who actually represents Newark, this is a wonderful item this morning, and I'm happy to say that we've got good news, and it's always good, particularly at the beginning of the year, to have a good news item. And with regard to this, I have to say, in last week's Newark Advertiser, it was headlines. So thank you to the hospital for organising this. And to discuss this with us this morning, we have our usual attendee, which is Lucy Dadge, who's the Director of Integration, Newark and Nottinghamshire ICB. We've got David Ainsworth. I don't think we've welcomed you here before, David, who's the Director of Strategy and Partnerships at Sherwood Forest Hospitals Trust. And we also have Rob Simcox, who's the Director of People I should think you've got a lot of work there, David, Director of People. So, can I give way and ask that we start this very good news item? Thank you.
Thank you, Chair, and thank you everybody for giving us the opportunity to talk this through with you. So we've provided a fairly comprehensive paper, so I'm just going to provide the headlines, and then between myself and my colleagues, we're very happy to take any questions that members have got. So just a bit of background, the NHS nationally has made funding available to increase planned care activity, so outpatients, day case procedures and planned operations, to address the backlogs that arose during COVID. Local systems like ours have been asked for 2 years now to establish what are known as elective recovery plans, and where possible accelerate the speed of recovery of planned procedures. The target for this last year was to deliver activity at 110% of pre-COVID levels, and I'm really pleased to say that historically, since and during COVID, Nottingham and Nottinghamshire have done really well in sustaining elective activity. And we do use a range of methods, including putting on additional operating lists at weekends, utilising the independent sector, and even bringing in extra staff to operate in our own accommodation to maximise productivity through the facilities that we have. However, it is recognised that sometimes to really ramp up throughput, we need additional physical capacity and staff. So the target for 24-25 rather, is to increase our elective throughput to 130% of pre-COVID levels. And this paper sets out how we're really keen to use this opportunity to access NHS capital funding to expand the Newark Hospital site so that we can provide more care from that location. And fundamentally, as Newark Hospital doesn't directly admit emergency cases, it does provide a fabulous location to provide protected and ring-fenced capacity to ensure that patients can secure a slot for planned care procedures that won't be impacted by surges in emergency activity. And another way in which we can make a real difference to waiting times and patient outcomes actually is to focus on optimising day case procedures, which is where all of the patient's treatment and care is provided without the need for an overnight stay. And again, Newark Hospital's got a fabulous track record, and it is ideally placed to become a focus for increasing this type of care. So what we're doing, what colleagues in Sherwood Forest with support from the Integrated Care Board are doing, is progressing a business case to enable them to be able to expand the number and range of procedures provided from Newark Hospital. So the headlines that are in the paper are as follows. So we've looked in detail at what areas of specialty can safely be provided from Newark Hospital, and we've also looked at national best practice and something called the Getting It Right First Time approach. So that's where we look at what makes what is an optimal way to operate, and we've identified what are known as high volume, low complexity specialties. So specialties like ophthalmology, urology, eyes, nose and throat, and elective orthopaedics, so planned, not trauma. And this is the kind of activity that you can really optimise through this kind of day case type approach. We have also identified, looking at those specialties which lend themselves to be provided in this way from the Newark site, if we invest £5.6 million worth of capital in capacity at Newark for this type of care, together with some additional staff, we think we can undertake around 2,500 extra cases at Newark Hospital if we can invest that funding in the last quarter of 22-23, which is now. So as the paper says, the money will be spent on an additional theatre, a modular laminar flow theatre for elective orthopaedic activity, just to clarify, not trauma. Improving facilities on Minster Ward to undertake more cataract operations, eye operations. Improving the Minster Ward to enable X-ray guided injections, and also upgrading outpatient treatment areas to do more urology procedures like flexible cystoscopy. And there's also some additional vascular work that we can do. So I think we're really clear about what we need to build. We're really clear about what specialties we can have the most impact. What we then need to be sure is that we are in addressing those particular specialties, we're having the optimal impact on our population health. So we've used a range of analytical and insight mechanisms to assure ourselves that, as well as providing an overall increase in access to care, that in selecting Newark Hospital and those specialties, we will have a positive impact on health inequalities, that we will enable those who can be traditionally find it hardest to access care, that this provides a particular opportunity for them. And the paper outlines the approaches that we've taken. So probably finally for me, really, in summary, as an integrated care board, we very much support this business case. It does increase overall capacity at Newark Hospital, and it makes it easier for patients to access care based on where we think need and disadvantage is greatest. The ICB, as it routinely does, undertook an equalities and quality impact assessment, and all the issues that were raised in that were fed back to colleagues in Sherwood Forest Hospitals, and they've taken account of them as they develop their proposal. So the reason that we're here today is that to access the additional money and have the maximum impact that we possibly can in this next year, Sherwood Forest Hospital colleagues are keen to progress with recruiting staff. So we are recommending this proposal to this committee to enable colleagues in the trust to start a public information and staff recruitment campaign. Thank you.
Yes, we will. Thank you.
Thank you. Well, thank you very much, Lucy, for that. I have to say, this is very, very welcome news for Newark, and I can speak on behalf of an awful lot of people since I represent a big part of Newark. What you haven't mentioned, which is vitally important, people in Newark do use Kingsmill Hospital. And until, I don't know how many years, couple of years, the years fly past, I'm not quite sure. But there used to be a bus from Newark to Sherwood Forest Hospital in Mansfield. And I suppose the same old thing, it wasn't used enough, and so the bus was taken off. And to many, many people, that was a complete and utter disaster, that they couldn't get to Kingsmill very easily. So the very fact that you're bringing diagnostic treatments, scans, and all those type of things, plus operations, to Newark Hospital is very, very welcome by the people locally. And as this committee have always been told by yourselves, it will never revert back to an accident emergency hospital. I was only speaking to somebody this morning who cut their finger on Saturday, went down to the minor injuries unit and was praising what they'd done. So it is very, very welcome, and I congratulate you on coming back to us and really doing what we've been asking for in Newark. Can I just check one thing with you? Will there be an MRI scanner there?
Thank you, and thank you for the welcome. Morning, everybody. So I'm David, the Director of Strategy for Sherwood Forest Hospitals, as you said, and we already have an MRI. We have a CT scanner on site at the moment. Yeah. We are in the process of bidding for more national funding for MRI scans, and as part of that, we would absolutely anticipate having over time an MRI scan that's actually in the building and as part of the hospital. Excellent. Because we recognise that the quicker we get people to a diagnostic test, the earlier we can get a diagnosis, whether that be cancer or not, and that in itself improves patient outcomes. So that is our long-term vision. Timescales yet to be defined.
Lovely. Well, I'm sure when you get up and running, we will make a visit to you, my vice chairman and myself, and any other members of the committee who might want to have a drive over to Newark and have a look at this hospital. It really is a very good hospital. It's very clean, the staff are very pleasant, and you don't sit around for hours waiting for treatment. I really am very impressed with it. So thank you. Have we got any points of questioning from anybody, please? Any members? Councillor Welsh.
Yeah, I've got a couple of questions. The first one, while we're mentioning MRI scans, what is the situation with regards to paediatrics and this here? And is there any plans to have a paediatric MRI? The reason I ask this is my son had to have I don't know if you have ever said this before, my son had to have an MRI. So I had a couple of MRI scans. The first MRI scan he had at NUH, his airways weren't protected, and he ended up choking on his tongue and he stopped breathing. And it took me a great deal of time to actually find out from NUH what had actually happened. It was a really horrendous experience. And it's only after having that experience did I realise that there is another option for how you MRI young children and babies. And actually, me and my partner have donated quite some money to actually, and I think you've got it now actually, at the facility at Queen's. You've got one now. I understand you have anyway. So that's my question with regards to MRI and where do paediatrics fit in with regards to this. The other questions that I have with regards to it is there's a lot in this report that talks about the backlog that has been caused by the pandemic, etc., etc. But if I look back through history, and I've been lucky in the fact that I've worked in jobs where I've had direct contact with NUH and reports from NUH. We've had black alerts at NUH since 2016 on more or less a yearly basis. So 2016, 2017, 2018, 2019, which has caused the halt of some non-urgent operations. So my question is, have they not all over the years had an impact? Because I'm struggling to see. COVID's had a huge impact, of course it is, but has this not been a cumulative thing over many years? And should we not be saying that and putting it all on the pandemic? My other question relates to recruitment. I'm well aware that there's huge challenges in recruitment with regards to the NHS in basically all roles that you can think of, and I'm just wondering how to get those recruitment levels that you need in a sufficient timescale, and are you looking elsewhere out of the UK with regards to that? I know with midwifery, you've looked out elsewhere outside in other countries, and what that recruitment plan looks like, because that is going to be absolutely essential, and actually I see as one of the blocking points. Last but not least, I just want to say this is a really positive report, and it is nice to read something that is going to benefit people and is going to help people. And this, for me, is exactly what the NHS should be doing at this time. I'd like to see this elsewhere in Nottinghamshire. I know that you're under an enormous amount of pressure at the moment, and I know there are a lot of people that are working really hard to ensure that those pressures are relieved. So my last question is, without taking anything away with this, because I think it's absolutely brilliant, what kind of impact is this actually going to have? Like, if we're talking, say we're talking about there's 100 people in Newark that are waiting for this, when is that impact going to happen? When are we going to see people being able to access these services and get these MRI scans? Because that is essentially what I'm interested in, is kind of the data side to it, because this is absolutely fabulous and I think we'd all agree with that. But when are the people in that surrounding area going to see that? And then last but not least, and I apologise if this is in the report and I've missed it, who is this going to impact mostly on? And is it a certain geographical area, or is it, say, somebody's auntie that lives in Gedlin would go to Newark Hospital for something if they've been waiting over a year for something? So who are these people? Is it specific to a geographical area, or is it a Nottinghamshire, a Nottinghamshire thing? But again, I just want to say, under enormous pressure at the moment, and I think you are doing the best job out of a real, very difficult circumstances at the moment.
Who's going to answer those questions? Lucy, over to you.
Thank you, Councillor Welsh, as ever, and I'll have a go. I'm definitely going to ask my colleague here to talk to you about recruitment, because that's his job. But I'll just hopefully I'll cover your other issues. So your question about will this investment at Newark Hospital have an impact on paediatric services? And the answer is no. And just to say, I'm genuinely sorry to hear about your experience at NUH, which we're happy to talk to you about separately. But this particular investment will not impact on paediatric services. And I don't know if David, you've got anything else to say about that.
Only other than to say, and again, sorry to hear your experience at NUH. We're obviously Sherwood Forest Hospitals who run Kingsmill, Mansfield, and Newark Hospital, and I think the example that you give is a good reason why we wouldn't want such complexity at a hospital like Newark, because simply it doesn't have the infrastructure, and neither should it have.
Councillor Welsh, it's very astute to note this isn't the first time that we've experienced pressures in our emergency pathway, and it's been coming for years. And what you describe as black alert, absolutely, I think that was the terminology back in 2016, and then we went on to no, absolutely, and this is then it becomes Opal, and you start to see Opal 4, and now you're seeing what's called critical incidents, and you are right. This has been a building picture, but what I can, and again with regard to NUH, which you're talking about there, what I can tell you quite categorically is that NUH had a very pre-COVID. NUH had an extremely good reputation for maintaining its elective targets. So the key one was that 92% of people would have a referral for treatment within 18 weeks. And pre-COVID NUH were extremely good at achieving those targets. So I would agree, as our population ages, as all the things that we know are happening in the broader, context, we have had increasing demands for emergency care, which have always impacted to some degree on planned care. But I think I can say categorically that the challenge that we are facing now is the recovery from COVID, because on or around, I think it was the 17th of March 2020, we had some really clear guidance from the then head of the NHS, which was that we were to focus all our activities upon dealing with COVID pressures and those sort of life-threatening illnesses, and that required us to, and I think we all probably feel that's quite the right thing to do, to actually set aside all but those extremely clinically urgent planned procedures like the cancers, which in Nottinghamshire again, we achieved quite significantly good outcomes for people with those. So I'm not saying there hasn't been a slow growth in emergency activity and its potential to impact upon planned care, but I can say that what the backlogs we're dealing with now are very largely COVID related. What COVID did tell us, which I think this proposal builds on, which we already knew pre-COVID, was if you can actually separate how you provide planned care, physically separate from where you provide emergency care, you are much more likely to protect that capacity. And that was a very clear learning from COVID, and that is why we see Newark as a fantastic site to provide that really protected capacity. So I think that would be my response to that question about where the backlogs are really coming from. I'm going to hand over to Rob, I think, now to talk to you about recruitment.
Yes, I've got you on the list.
I'm happy to take the question in the context of responding to both, if that just provides some clarity.
Paragraph 5 of the yellow papers, it talks about the impact on Sherwood Hospital staff, and that's the modular theatre and the upgrade and the minor operations will provide capacity on Newark Hospital site, which will require additional staff. And it states the Trust has developed a recruitment plan to support current staffing levels, as well as additional staffing requirements for this additional activity. Can you outline what this recruitment plan is and how it differs from the current plan, bearing in mind the staff shortages in the NHS? And how confident are you that new resources will be available? The new resources will be able to be staffed. Also, We know that the actual urgent treatment centre is still closed at night because of staffing issues and the fact that there's no guarantee for staff safety. Can you tell us today what the current staffing levels and shortages are in the Trust, Newark Hospital and those at NUH?
Okay, I'll happily start to describe our approach in regards to the recruitment to this opportunity. Firstly, I'll describe the context. So, to support this investment, it would require 13 whole-time equivalent individuals, which are a combination of registered practitioners and unregistered practitioners. I will use a barometer of success that we utilised towards the end of 2022, where we were successful in recruiting over 20 people through a very proactive recruitment campaign at the Newark site, which was complementing some of our inpatient wards. So there is optimism there, Councillor Carr and Councillor Welsh, in regards to the likelihood of being able to recruit to these opportunities. I'd also go as far as drawing around the collaboration with partners across the system around providing rotation opportunities of giving trained individuals variety, whether that's through an acute site at Sherwood or that's an acute site at NUH. I think what we've got to also recognise is that there clearly are pressures across the NHS at the moment, and the proactive recruitment approaches that have taken place under my personal leadership at Sherwood have drawn fruition over the last few years. I'll perhaps look to colleagues David and Lucy in regards to some of the wider context at Newark. But, you know, providing that opportunity to our local people and our local community, what we're here today to talk about is the opportunity then to start to do some very proactive recruitment campaigns to what I feel would be a fantastic opportunity for the people of Newark or Nottinghamshire.
Yeah, and I mean, probably what I would add is I think we are really lucky in Nottingham and Nottinghamshire to have Newark Hospital and Sherwood Forest. You know, they are a jewel in our crown. They get, you know, they attract staff. They have very good staff satisfaction outcomes. So I think we are really confident that to develop this particular service, we will be able to recruit and retain the appropriate additional staff.
All right. Everybody else? Right, let's move on to the
Sorry,
list.
just
I did ask about what staff levels were like at the moment in the Trust Newark Hospital at NUH, and also providers what you just said. Will people potentially be drawn away from Nottingham University Hospital staff?
Yeah, I mean, I would pass over to my colleague to comment upon that. We can't today I can't give you any detail on NUH's current staff fill rate. And if that's something that the committee would wish to scrutinise, then of course we would be very happy to come back with colleagues to do that. I think I'm going to hand over to Rob to talk about how we manage staff across all of our trusts.
So, I mean, I'll happily share the context of vacancies we have within the organisation at the moment, but the granular detail to the site of Newark, I don't have to hand. The context at the moment is a vacancy factor of just over 7%, which is circa 300 or so whole-time opportunities we have at Sherwood at the moment. What I can share, though, in reference to your point around how these opportunities might attract others from the Nottinghamshire system, I'll draw you back to my reference of collaboration here around providing rotation opportunities, negating the need for individuals to leave one organisation to another. And as we move forward in a collaborative way, I truly feel this is a unique opportunity of providing individuals with variety of working in an acute setting or in a local hospital setting, which these opportunities will be able to provide.
Thank you. Lucy, did you want to come back?
Yeah, sorry, just to Councillor Welsh's question about when will the difference happen and to whom, and David can support me on this. The reason we're here today is we really want, well, colleagues in Sherwood Forest really want to get out, make the public aware of this opportunity, recruit the staff, with the hope that this will be, all of the investment will have been made and the new facilities will be ready, broadly speaking, from April this year. So that's why we're here today, to give ourselves a lead in to do that. We talk about, overall 2,500 additional types of procedures. One thing I will say, so these are extra procedures. This isn't people that might have been treated somewhere else can go to Newark. This is additional capacity to do extra work. Where will people come from? I mean, what we do know is, as the paper describes, we've got high levels of deprivation in the geographical area to the south of Newark. So we do hope that this will become more accessible for those patients. But it doesn't stop. People can still choose to go to Kingsmill if somebody chose to. But the bottom line is there is additional capacity for demand that exists around the Newark area. Patient choice obviously will always be there, but I think when you provide additional capacity, you provide greater choice.
Thank you. Right, moving on. Councillor Adams.
Thank you very much indeed. Good morning. Just a couple of things. I just want to first of all say it's fantastic to hear of the success of the bid from central government. So congratulations to all of you and the wider bid team. Just talking about the geographical point you made there around care. I'm guessing then it would just, as and when people are dealing with treatment, whether it be through their GP or whatever, on the list of available locations within that, it just shows up as more slots available effectively. Yeah, that's what I figured, and so that makes a lot of sense. And I wonder, with the other bids that you've put in, when because you mentioned some other bids in your point there, I wonder when you will hear about some of those, and if you could expand. I know those other areas. I'm sorry, it's sort of diving in on a point here. And Lucy, it wouldn't be a health scrutiny committee if I didn't ask you if we needed extra parking to cover the additional use of the hospital and what.
Excellent parking. I should have mentioned that.
I just couldn't leave it without it, Chairman. Yeah, that's it from me. Thank you very much.
Great. Thank you. So first of all, the other bids. I think we do have an intention on your work programme to come and talk about things like community diagnostic centres, which is a nationally driven project, and it's something that we are working really hard towards. So I think within the next 6 months we will have a better idea of the exact amount of money we've got and where we can channel that to. So we'll happily come back and update you on that and keep you abreast. In terms of car parking, I'm really glad, Councillor Adams, you raised that, and I am pleased to say that in addition to the funding that we've talked about today, and in collaboration with our partners at Newark and Sherwood District Council, we've acquired some land at the side of Newark Hospital. That's now been hoarded off. There's hoardings been put up around it. If any of you have been on the site, you'll have seen that. And we think that will give us up to 80 additional car parking spaces. I say up to because we're just in the process of planning out things like disabled parking and car charging points and the like for electric cars, so up to 80, but maybe slightly less. And our intention is we've put in AMPR type barriers, and our staff will be able to use that additionality. That will free up the entire site then for patients coming on site. So we've got the land, and we're right through the planning cycle at the moment with that. So that's great news for Newark Hospital again. Thanks.
Councillor Pringle.
Thank you, Chairman. Thanks to Councillor Adams as well, because it's raised something that I hadn't thought of. So is this part of the investment of the 40 hospitals from the central government that we spoke about over the last couple of years, or is it separate to that? Just so I'm clear, I can answer that at the minute. And I've benefited from Newark Hospital, the CT unit, too, and I think there was a breast X-ray centre there as well. So I understand exactly, and I think this is a right bonus for Newark people generally, because it is an area of poverty. So I think that's a bonus. But I think transport, which the chairman has raised, to and from, is going to be vitally important if we're going to reach the 2,500. I'm assuming not all of them are going to be from Newark, so there'll be some travel involved in that. So I think that's something that we have to work with transport providers now to maximise your lookout as to where we're going to be. The car parking, the ATX car parks, superb. The charges at the car park are ridiculous, as we know. That needs to stop. Okay, we need to be doing something there to reduce that in some way. Because of the area, and you mentioned the poverty, we're expecting people to travel on transport and to then have some sort of procedure. That's costly in some ways. So it'll be good to see if we can alter some of that. Rotation of staff. I've worked in places where staff are rotated invariably after the first couple of 3 months when people are keen to move and then things don't quite go right. The free objective to move slows down a little bit. So if there's any sort of direct you are going from here to Newark, I think we'll find conflict there. So I'd be really interested to see the response to your rotation of staff and how they are looking at things. But generally, really pleased. I mean, I think a direct question would be, I suppose, what is the current elective and non-elective care waiting list number now presently? Are we over and above that figure, or is that a figure that we think we can handle? Thank you, Chair.
So I will I'll answer your question about the new hospitals programme, and no, this isn't part. This is additional investments. The new hospitals programme in Nottingham and Nottinghamshire, we are benefiting. We've had the National Rehabilitation Centre, and we're still very hopeful that we'll get significant investment in the two NUH campuses, City and Queens. But this is a different funding stream. And we do make every effort we can to access all the funding streams that we can to improve our facilities. So that's just to clear. And similarly, the Community Diagnostic Centre, that's a difference. That's another funding stream. So this is all extra money. In terms of our current waiting list, I haven't got the data in front of me about where we are with our waiting list. But just to assure you that we do literally on a case by case, day by day basis, make sure, particularly when operational pressures are high, that we are treating our patients according to acuity, according to need, and maintaining as much planned care as we possibly can.
Thank you. Councillor Bergie-Cardle.
Thank you, Madam Chairman. Councillor Debbie Darby was hoping to attend today as a substitute, but unfortunately she's feeling unwell. So she's asked me to read out a brief statement from herself regarding the news. So I will read this out on her behalf, if that's okay. And like you, Madam Chairman, Debbie represents a significant part of Newark Town. She represents Collingham Division, but not just Collingham Village, but all the villages and part of Newark around. So she writes, as the County Councillor for Collingham Division, can I welcome the news that the Nottingham and Nottinghamshire Integrated Care Board are advising that the Sherwood Forest Hospital's NHS Foundation Trust has an opportunity to access capital funding to expand elective day case activity at Newark Hospital. As members will know, this is a huge priority for me and residents of Newark and its environs. We welcome any additional funding, staffing, resources at Newark Hospital. Last year I met with Paul Robinson, Chief Executive of the Sherwood Forest Hospitals Foundation Trust and the former Clinical Commissioning Group to make the plea for additional services at Newark Hospital. I am delighted that my pleas have been listened to, and this news will be welcome in places like Newark, Collingham, Winthorpe, and across villages in my Collingham division. I welcome the fact that 5.6 million of NHS capital funds will provide an additional modular laminar flow theatre to treat orthopaedic cases, 2 minor operations suites to increase capacity for more procedures in the outpatient treatment area and other improvements. I hope that this is just the start of additional funding. This is the first step towards our ambition of a return to a full-time accident and emergency at Newark Hospital. As members will know, in 2011, A&E services at Newark Hospital were downgraded to an urgent care centre, and Newark Hospital currently operates as an urgent treatment centre. It is one of the biggest towns in the UK without direct access to a full-time accident and emergency department. Ask anybody in Coddington, Collingham, Newark and the surrounding villages what their number one healthcare concern is, and they will tell you it's the fact we don't have a 24-hour A&E. People bitterly complain for many a routine trip to A&E is a 2-hour round trip is the norm, which I think I should mention earlier, Madam Chairman. Newark and its environs are set to grow by around 9,000 houses due to the council's local house building plans over the next few years. We can't sit back and wait for Newark to grow exponentially without putting the right health infrastructure in place. Finally, as I say, this additional funding is a good start, but we must be the beginning of extra resources that lead to a full-time A&E. Thank you, Madam Chairman.
Thank you, Councillor Purdy-Haren. Yes, I think I must make it very clear our thanks to you for listening to this committee when we've been asking for Newark Hospital to have further services, and we have done that as long as I've been chairman of this committee. So I'd like you to know from this committee, which all the members are here except Councillor Pringle, who might be a new member.
Fully supported,
We're very grateful for what you've done. Vice Chairman.
I'll bring it back to this report and just say thank you ever so much. As someone who represents Mansfield, or Warsaw, in Mansfield, I think it's a really great thing. I know people already use Newark for minor surgery from Mansfield, and I think anything that expands what we can do is brilliant. So thank you ever so much, and thank you for the detail in the report.
Thank you, Vice Chairman. Councillor Kerr.
Yeah, thank you for coming along. It is a scrutiny committee, so not just to scrutinise the report, but also to scrutinise what you said. The chairman quite rightly asked you, will the hospital be getting an MRI scanner? And your answer was that it was a long-term vision. What is long-term?
So it's difficult to say exactly. The honest truth is we don't have the funding capital agreed for that. So I think I made the offer to come back and update the scrutiny committee, and I commit to doing that. So as soon as I know something, I'll let you know. Sooner the better, obviously, for us all.
Can I just check you with that? Have you not had a portable one there? I thought so. And is the portable one still there?
Yes.
Or does it come?
Yeah, people can access MRI today at Newark Hospital. It's a portable. It's
I thought
outside
so.
of the actual building.
Yeah.
And there's almost a mobile unit, I think is the best way to describe it. So MRI is available already. My longer term view is that needs to be a more sustainable solution.
Yeah. Members, have any members got? Oh, Councillor Welsh.
Just while we're on the subject of MRI scans, and I apologise, personal experience and a little bit of knowledge, they are vital, aren't they? MRI scans, absolutely, especially for the early diagnosis of so many issues. It's unbelievable. Is there anything we can do as a scrutiny committee with regards to supporting your bid for an MRI scanner? Is there something that Councillor Saddington could, not saying that you will do it or anything like that, saying, is there someone that we can write to? Is there anything that we can do? Because you've expressed how important it is. I know how important they are. I believe that cabins aren't the long-term future for our healthcare, as much as you won't believe in that either. I'm sure. Yes, it gives us that facility there, but there is something else about as well that humanistic thing, isn't there? When someone's going for an MRI scan, there's the chances they've got to worry, haven't they? To have it inside a hospital with a nice waiting room outside is how we should be treating people. It's what our whole service is all about. So is there anything that we can do for the people of Newark and Mansfield that access that hospital for an MRI scan in order to be able to support you, in order to be able to get that? Because I will gladly sign a letter or go and speak to anyone that I need to. Not that I've got a massive amount of influence, but I would say as a member of the Scrutiny Committee, we would support that. So as well as scrutinising, how can we support you to get what you need for those people?
So I think what I would say, you're right, access to faster diagnostics, either for screening. So I think about things like targeted lung health checks that Mansfield benefited from quite considerably, where we bring people in without symptoms of illness and we screen them. Now, actually, we found that's a CT scan that you use, and we have found that actually having mobile units that you can take to your populations and you might put in a supermarket car park or whatever is a really good way of providing that care. So I think we need to think about a bit of a mixed economy, really. Targeted lung health checks, and we know we're not here to talk about that today, but we have done really, really well in Nottingham and Nottinghamshire in being pioneers for targeted lung health checks, and we have really clear data about by having that modality, that screening modality that we can sort of move around, that we are detecting and treating lung cancers much earlier and most definitely saving people's lives. So I think we will have talked to you about this. So your support is really welcome. We do clearly need as much inpatient diagnostic capacity, MRI, CT, as we possibly can. So when people might get admitted through A&E, they get rapid access to things like CTs for strokes. So we do know that both of our hospitals have equipment replacement plans. They make sure that they focus on making sure that type of equipment is available. But I think what you're talking about is the thing that's called the community diagnostics, which is a really big push from central government to say that where people don't need to go onto a hospital site, but they do have symptoms, we should be building community diagnostics centres in the community. I can assure you, we are really actively engaged in bidding for those funds. And as David said, we can come back and talk to you about how those proposals are going. I think what you can do that would really help us is when we do come is to support us, because as part of any business case that we submit, we need to demonstrate that our local health scrutiny and our local democratically elected representatives support what we're doing. They think we're doing, putting these things in the right place. So I think in terms of can you help us get access to money, I think there is money available. It's just supporting our bids, and we are very well on with community diagnostics.
Thank you. We are discussing the community diagnostic centres in March, and any assistance this committee can give you towards getting an MRI scanner, we are happy to support your funding request. So I think with that, members, we have fully understood that we've got something to celebrate, which is York Hospital expansion. And thank you very much again. Thank you very much. And I'm sure we'll see you before very long, because Lucy, you seem to be a permanent feature here.
Just before we finish this item, just so that we remind ourselves of the recommendations before us on page 15, we've asked that we consider and comment on the information provided, which we have, approve the proposed plans, and endorse the start of a public and patient information publicity campaign from early January. And from what I see on the floor, we have full support for that. Is that unanimous?
I omitted to say that. I assumed everybody was pleased with it. So.
I'm sorry, I became the chair there.
No, that's fine. Thank you, Nell. And thank you to all of you. We'll let you go out now in this nasty weather. Oh, I forgot about Alex sitting in the corner there. I'm so sorry. I thought you weren't sitting with the rest of them. Thank you very much. Bye-bye.
Thank you.
Right, members. Now we're just coming on to the work programme and reasons why and why not things are not on this agenda. Okay, now.
Yes, if I could just make an introduction to this item, thank you very much. If you want to refer to pages 24 and 25, especially because we'll be discussing the next two meetings in the first instance. For the February meeting, we've got Anthony May coming along to give his report on his key priorities and challenges, and also we would be looking to do a double hander, as it were, to cover off both a maternity services update and winter pressure update within that one item. We also have access to GP services, which I'll touch on in a moment, and also you'll see that I'd hedge my bets somewhat at the time of publication, because we had some difficulty in getting a definitive answer in respect of dentistry services. I can confirm that colleagues at NHS England can come to our March meeting to discuss dentistry. So we will have the update on colorectal and hepatobiliary services at the February meeting, as was originally scheduled. A couple of points to make, and they've been alluded to at the outset of this meeting. The first is, in terms of the access to GP services, it is correct to say that these were originally scheduled for our January meeting. We did receive a request between November and January for that to be rolled back. The ICB said that they weren't, because of holiday and staff absence, that they weren't in a position to do to have a definitive report through in January. So that was discussed with the chair and vice chair, and it was agreed to roll back to the February meeting. It's also been mentioned correctly that health visiting was something that we were intending bringing to the January meeting. There's quite a bit of additional context to that, if I could explain briefly. That is that health visiting is part of the Healthy Families programme, which is being recommissioned and will be considered by Cabinet in March, now in March 2023. The programme, the wider programme, is commissioned by adult social health and public health, but it does impact significantly on the children and families department as well. And there have been discussions between adults and children, and agreed that there would be a cross-cutting joint adult children scrutiny work done on the programme in the near future and in advance of the recommissioning taking place. As a result of that additional context, what we would propose is that that work should play out, and if there are issues still of concern to this committee, then we would drill deeper, as it were, on issues of specific concern. Because of that additional development, I did take the item off the work programme, and without explanation to you in advance of the meeting. And I do apologize. If I had my time again, I wouldn't have done it in that way, and I would have explained it in more detail. But it was a live issue and developing over the course of the last several weeks. So that's an explanation as to why health visiting doesn't appear on the work programme as matters stand. But that provides that context. And with that, I'll hand back to the chair and then open the discussion. And can I just say that at the end of several long meetings here in the past, the work programme doesn't always get a full going at, and it's quite nice to have the time and the energy to give it its consideration today. Thank you.
Thank you, Noel. So looking at February and March, should all these items go ahead, we're going to be here for a fairly long time. So, but we work on the principle that something always has to fall because a report isn't ready. So we'll live in hope on that one, perhaps. Councillor Welsh.
Thank you, Councillor Saddington. I'm just going to start with regards to the health visitors because that is something that I raised as something that I wanted us to scrutinise. And one of the reasons that I thought it was very important that we scrutinise that is because of our current state of our maternity departments in NUH. Health visitors might be going into this healthy families bubble, but there are statutory things that health visitors have to do. And I am aware that in some areas of Nottinghamshire, those age limits are not being met, including myself. Including my own child's assessment was not met in the time frame that is statutorily supposed to happen. So if we just go through some of the things that the health visitor's role does, this is up until the child is 2.5. Okay, so they always, when you leave your hospital at NUH, you are no longer under the care of a midwife. So when I had pain or anything was happening to me or struggling with breastfeeding, when I left that hospital and I phoned my midwife, it's not me anymore, you need to phone a health visitor. And you phone the health visitor, okay? That includes antenatal depression, that includes breastfeeding, that includes not taking the bottle, that includes safe sleeping, that includes problems with hips because they've been born breech. It includes loss of hearing by children. All of these things and much, much more come under a health visitor when your baby is born. Bearing in mind the context of which this has to be put on in Nottinghamshire is the state of our maternity departments in Nottinghamshire. Then at 5 to 8, so you have your first visit you have when you come out of a hospital is a health visitor. I never had it because it was pandemic. So, but now the first visit you should have is a health visitor that comes and makes sure if you've had a C-section, the health visitor comes and makes sure that your scar isn't coming open or isn't getting infected. Another health issue. Then at 5 to 8 days, the health visitor comes around to do the heel prick test on your baby for cystic fibrosis and sickle cell. And then you have a new birth visit where they sit down and they go for anything. This is, of course, unless you've got other problems going on, which a lot of mothers do get a lot of problems coming out of our maternity department. Then at 14 days, they get another statutory visit by the health visitor. Then you get a support visit from the health visitor with 6 to 8 weeks after birth. Then you get your development room, which is, I'm going to say ASQ, but I may have got that wrong actually, which is a statutory assessment of how your baby is developing at 12 months. I cannot even begin to tell you how important that assessment is for children and young people in Nottinghamshire. It is absolutely critical. And then you have another one at 2.5 years, which then looks at all of the questionnaires that you would have known it, Councillor, because you have to fill it in before your thing, and you have to try and test your child. Can my child lift his legs that high? Are they saying 15 words or not? And you find yourself counting. Yes, it's saying this, it's saying this. But actually, it is really, really important assessment. And actually, what it does as well, it gives the mother a connection with a professional as well. So vulnerable children, actually, it is critical to identify some of those vulnerable children where things aren't happening as they should be. Health visitors, up until they go to school, have an absolute critical role. My point is, even more so, from when they are born and they leave that hospital, and you will know, Councillor Saddington, because you've had the emails with regards to experiences in maternity, but the health visitor's role is so important. For me, we should be talking to those people that deliver those health visiting services, even if we say we want you to come here and we want to talk to you about what you deliver across Nottinghamshire from 0 until 3 years old. Even if we just say that, because my worry is, and it continues to be my worry, that postnatal depression, things like language development, there's been a massive report on that by the Chief of Ofsted at the moment that is saying that children are going to school across this country without the language development that they should be having. If we don't do this now, I'm worried that this will escalate into something. And I'm concerned that officers are directing this and not me as a member of Scrutiny Committee that has highlighted from people that have contacted me by the groups that I run with women of health visitors crop up again and again and again and again and again. And there's an issue. There is an issue. There's a recruitment issue, and there's an issue with them not having enough capacity to do everything that they need. So what I'm saying is, and I'm saying this publicly and I'm saying it officially, I want health visiting to go back onto the agenda of health scrutiny. If anyone that wants to argue that from the moment you leave from hospital up into 2.5 years old isn't purely a health thing, I would say is categorically wrong. We're talking about the health of mothers and babies when they leave hospital. And if the health visiting isn't right, what happens? If we've got maternity departments that are working, what happens to those women and babies? And I think we're on a slippery slope if we don't look at this. I really do think we're on a slippery slope given what is happening in our maternity departments. So that's my first point with regards to health. So I'm officially asking you, as chair, to actually put this back on agenda as a matter of urgency. And if you want to focus it from 0 until 3 years, what happens when they leave from hospital? Because as elected members, we need to know. We definitely 100% need to know what is happening when mothers and babies leave that hospital. Because it's the same health professionals looking over the whole lot.
Okay.
That's my first point. Sorry. My second point is, Councillor Saddington, is 21st of February 2023. We've talked about Anthony May is going to talk about key priorities and challenges. I've been to some board meetings at NUH where they've discussed maternity services and the critical incidents that are still going on. Serious incidents, which for point of clarification is when either a child dies or a mother dies or there has to be medical intervention to stop them from dying, are still becoming 10, 15 a month. Still in our maternity departments as we speak today. Now, to suggest that to include maternity services and winter pressures update all as one, I find unacceptable. I can't even begin to tell you how disappointed that I am by this scrutiny committee that we reverted back to coupling maternity services with anything else. These families and women have to continue to speak up again and again and again. I'll be frustrated. Maternity services need to be treated as an individual item on this agenda. I will, and I'll express it. And I'll tell you what, you'll get a really raw deal from the media on this as well. If you expect me to sit here and listen to Anthony May talk about winter pressures and then add on maternity department as well as that, I'd be very, very disappointed. We need to give maternity services, the women and the babies, the respect that they do and have that as a separate, a totally separate item. Winter pressures on its whole on the 21st of February is going to take up a massive amount of time. And that will go first. That will go first. And then we'll have a bit at the end and we'll have a rush discussion about maternity services. And I don't want that to happen. So that's again, I'm calling for a separate agenda item for maternity services where actually it's not just Anthony May briefing us, it's those people that know what's going on in those departments, those people that are talking at those board meetings about those serious incidents that are still happening in our department, because women are still being shifted around hospitals. Women are being induced on a Friday and then being told by Saturday, well, we hope you can wait out until Monday because we've got no one to do it at the moment. It needs to be a separate issue without interfering with the current review that's taking place. And GP services, I think something needs to be done about the fact that they're telling us after all these months of us saying updating GP services are now telling us because someone's off ill, they've not got the data. Councillor Saddington, I can go to the Commons Library tomorrow and get GP data. I can go and sit in the Commons Library. I can't sit in it, I have to ask for it. I'm not an MP. But I can go to the Commons Library tomorrow through my work and say, can I have all the GP data of the last 3 months? So what are we going to do about the fact that they've had all this time to do it and they've not come back and told us, because every single person in this room will no doubt have had emails or phone calls about the fact that they cannot access a GP service. And this isn't about GP bashing either. I understand they're under enormous pressure, but we need to know what's going on. We need to know why people can't get a GP appointment and what effect that's having on A&E, etc. Dentistry has been on the agenda for goodness knows how long. Again, I raised it, and the reason I raised it is because it's incredibly difficult to get children on an NHS dentist. I can't tell you how many dentists people have to phone in the Gedling area before they can get a child on to an NHS dentist when they're born. It's ridiculous. So what, Councillor Saddington, we've got a massive health crisis going on. Whether you want to use the word crisis or not, I'm going to use it. And yet here we are at a health scrutiny committee with one agenda item on it, which is the Newark Hospital. Now, I don't believe in taking anybody away from their day job when something so serious is going on, and nobody does here. So to infer that is unacceptable, in my opinion. As someone who's got a terminally ill father that is desperately trying to keep him out of hospital because he doesn't want him waiting on a corridor, trust me, I want them to sort out that hospital more than anybody else possibly in this room at the moment. Right, here we are sat at a health scrutiny committee with none of the agenda items that we're supposed to have, and waiting until February until Anthony May graces us with his presence and tells us what's going on in our hospitals. Goodness knows what they're going to be like until then. Councillor Saddington, there's a serious situation in Nottingham with our health services, and we as a scrutiny committee are the only entity that can ask those questions. They are not accountable to anybody else. And we're not asking these questions for politicians. I'm surely not. I'm asking it because as I go out my daily business, as I sit on a bus, as I talk to people in my local church and my local Shore Start Centre, people are not able to access their services, and they're doing everything possible to try and stay out of a hospital. People are in corridors for hours. I would ask Councillor Saddington that you bring forward the scrutiny meeting with Anthony May, and given the current circumstances, I will gladly sit here and have an extra health scrutiny committee meeting here, gladly, so we can have the full information about what is going on in our hospitals, what is happening next, and what we can do as a county council to support that. So that's my call to you, is the situation is so serious. It is so serious that we need to know. We are the only body that can ask that question. The only body in Nottinghamshire that asks that question. And that's what I would like to happen. And this isn't a criticism of you as a chair. And I hope you understand that I'm able to say this because I feel that you will listen. And I know that you'll listen. You might not agree, but I know that you'll listen to what I'm saying, which is why I'm saying it. But there are a number of issues that I've just raised: health visitors, GP appointments, dentistry, and the current state of our hospitals. And I would like them addressing here at the scrutiny committee at the earliest possible point. I think the 21st of February is far too long to wait for Anthony May to come here and talk to us. Far too long.
Right, I know that the Vice Chairman wants to come in, but I will answer some of the points you've raised, but I haven't written them down, so I probably won't remember them all. I know that we have chased dentistry, and everybody we chased, for some reason, and the officer will confirm this in a minute, has been difficult to get hold of somebody. Am I not correct, Noel, in that?
Yes, that is correct. The key contact that I was trying to get lined up for January is actually on sick leave, but there was no out of office or anything. So I was not getting responses, and therefore it took a lot more digging to get to the bottom of having dentistry come.
Thank you. Moving to Anthony May, he was booked whenever he was booked, and that, I believe, was before the winter pressure crisis. And we've had them here, and obviously they came back, am I not correct? They came back last month, I think. our last meeting they came back to, I think. And they are due to comment next month, and that is calendar. That is according to the calendar. I'm happy to have another meeting, but I think I could actually say that whoever you want to come won't have it in their diary and may not be free to come. I don't know who we would ask for. I mean, for the maternity, we obviously want the maternity people back. I'm happy to ask Noel to see if the maternity people will come back, and you can ask direct questions to maternity. You can ask direct questions to Anthony May regarding the winter pressures. I'm a little concerned personally, and I haven't raised it yet, that we have too much on this next meeting. Because if we have too much on the meeting, we can't go into it in depth because we know we have a time limit for 2:00 meetings. I'm also happy to have Anthony May next time. Happy to have the maternity staff and have it as two things. That probably is sufficient for that meeting, unless this report from City Hospital is just a quick update. I don't know about the GP services because I'm not actually happy with what we're hearing from GP services. We've had the GPs in who have been good GPs. They say that they're functioning, they're having their people in. I am getting reports weekly of people who can't access GP surgeries. And short of bringing those people in and saying you are failing, I'm not quite sure how we do get that information from GPs. I have a list of complaints, and I'm sure you do, and everybody does, of GPs within the division they represent, who people can't access. Short of bringing them in and saying, why aren't you taking patients? I think it's very difficult to get the information, because in actual fact, when I've reported those surgeries to Lucy Dadge, as I have done, somebody has been out to speak to the surgery. And I have to say, I'm sure when they get there, they're saying, oh, it's fine, we've got lists. It's that delving into that surgery. And I think the only way is to make a personal visit. And I have done that to a surgery. And I have sat there with district councillors who brought it to my attention that a surgery was failing. And I sat there and said, why are you not answering your phone? Why do you not have a better system for answering the phone? They say, we're updating it. Only 2 weeks ago, I had the same report back that this surgery is not answering its phone, not taking people, not giving prescriptions. People are sitting on the phone for an hour waiting for a receptionist to answer. How do we, as a health scrutiny committee, get these people to answer their phone, to give appointments, not to have people hanging on the phone for an hour? I find it unbelievable when you do actually ring up that you're past, you're number 8 in the queue. And it's as if those people have all the time in the day just to sit there and wait, whereas they're busy. But I've had reports that when people have walked past GP windows, they've been looking at something else completely different. How do we get into that establishment and say we have reports that it's not working? We would have to go individually, because it wouldn't be correct, from my point of view, to bring them in here and give them a good dressing down in public. That would not improve the situation. And I think if any members of this scrutiny committee have particular issues with their GP surgeries, let's look at it. Let's have a couple of people go round and visit and come back and tell us what they've found. And I can guarantee that each and every one of you would come back with at least 2 surgeries in your division that's not working. And that's probably how we need to address it, not bring people in here and publicly dress them down. That wouldn't be an improvement for our residents, which at the end of the day is why we're here. So let me just ask, I'll come back to you in a minute.
It is about GP services while we're on the subject.
Okay.
It's just that I had no intention of bringing GP surgeries here and dressing them down.
No.
What I am concerned about what I am really, really concerned about is as the situation in our A&E gets worse, as our situation with regards to 111 being overwhelmed, I would like to know the pressures that GP surgeries are under and what is happening with regards to those surgeries. Because surgeries that are in, my ward and my patch, where there's difficulties, is because there is a high level of patients and GPs simply do not have the time to see everyone that they need to see. And I know the pressures. I know 2 people that are leaving, not becoming a GP anymore because this 10-minute, in order to get through the people they need to get through, they're often put on a 10-minute appointment. And if someone comes in with the first thing and then comes in with the second thing, you think, I'm going to see a GP now. I'm going to do my second thing that's been going on to my ankles thing. They've been told that they can't do the second thing, and you've got to make another appointment. And that, to me, we could sit here and criticise GPs. So, but the thing is, we've got to acknowledge the pressures that are going on in our health service. It's not about dressing them down. It's about saying what is going on in our GP services, what is happening, and where is that pressure coming from. And Councillor Saddington, would have to look back at the notes, but I'm well aware that we asked a number of questions, drilled down on data to GP, that they said they were going to come back with an answer at the next time. And we've not had those answers. I can't remember what those questions are, I'll be perfectly honest, but I can remember there was some. Was it you? Was it you? Did you? I see you asked a couple of.
Mine was about basketball.
Yeah, there was a few questions that were asked with regards to how do we get so and so data, or how do we get data, and then there was the other question as well about those surgeries that are on the city border. Like, there are people in Beeston that go to a GP service, lots of people in Gedling go to a city GP, but the data wasn't there, so we asked for more data. There was a number of questions that were asked that we need those answers to as well. And I don't think we should just be casting them aside either. But I would say, with regards to GP surgeries, it's not about dressing them down. It's about looking. If we're looking at hospitals and Anthony May's coming, we need to have a real clear picture, the full picture of what is going on in our health services across Nottinghamshire. And a big part of that is GP, as you all know. A big part of that is GP services.
Just for correction, I wasn't saying they'd be dressed down. They will feel as if they're being dressed down by the very. I think they would. Because people are very cross that they can't access GPs. I get it every day, as does everybody else.
But I am not cross, and they need to know that's not the angle that we're going from at the Scrutiny Committee. And in fact, if anything, a lot of these people that work in GP surgeries actually want the opportunity to tell us exactly why you can't get those appointments, because they are fed up of being blamed for everything.
Which is what we had.
So and that's what they should come back and say. A lot has changed in GP surgery since then, with all due respect, and the situation for many people has worsened. You couple that with what's going on in our A&E departments, then we really need them back to tell us what is going on in GP services and where those pressures are, and to answer those questions that we asked previously that we agreed to in the minutes.
Yeah, which we haven't had them back. Just let me come to the Vice Chairman and then to Nigel. Sorry. Well, the Vice Chairman was first because she spoke to me. Okay, off you go.
Firstly, thank you for this work programme. I think it's really important we all actually have time to discuss this, because it's something, since I've been Vice Chair, that the meetings have been so long that at the end of the meeting we've all gone, this is what we're doing, and we've never really discussed people's priorities, and I think that's really, really important. Coming on from Councillor Welsh and health visiting, I totally agree that there's a huge issue. My daughter's questionnaire things were both done online over the phone. So nobody has actually seen my daughter apart from in a nursery setting. So it's something I've raised when I've been speaking, because I could have said anything, I could have put anything down. Exactly. How are you feeling? Exactly, and I think it is a really, really important part of that health visiting. But I also understand that we can't duplicate across 2 or 3 committees. So I don't know how we work it around, but there must be something we can do that if there's a gap in what they're discussing, that is what we need to delve deeper into. I'm sure there's something we should be able to do because it is such an important part. Because I think my worry is that they're going to go to school in September next year, and the children who were born during lockdown are going to have so many issues. But I don't know if that then comes under education or, and across the different committees. I think we need to work out so we don't have the duplication. With regards to GP surgery and or the stuff on the work programme, everything is so important. And I don't know how we always prioritise what we need to do. I do agree lumping things together isn't the right way. But we do need to look at the work programme, which is why it's really good today that we're discussing it, to make sure we prioritise what we need to do. And I think having Anthony May at the next meeting will be really good. I'm happy to have another meeting if Councillor Saddington wanted one. But I do think we get into the realms of the meetings lasting 4 or 5 hours at the moment. So, the work programme really needs to be looked at properly, I think.
I think the problem is they will be 2 very big issues on the next agenda, Anthony May and maternity. Maternity is always a big issue. And it concerns me that we've got other issues because I'm very mindful that around 1 o'clock people not only haven't had a coffee or a drink or a break, but actually some people are going straight into a 2 o'clock meeting. So I think for the sake of everybody's health, we should make sure that we can break by 1:30 at the latest to give at least people time to go and get a drink and a sandwich, which I've been very aware that we have had such long meetings, this hasn't happened. And we've had people dashing out to go to a 2 o'clock meeting. So it has always been something of recent that I've been saying, let's get these agendas shorter. So I am concerned when I saw it that we've got so many things, but it's the availability of trying to get people here. This is the problem. This report back to City Hospital, presumably that doctor, that's when he's available, is it? No, because if we put it into March, look at March, it's huge. So I think we need to take a detailed look at this. Councillor Khan.
Of course, the problem is, Chairman, that the NHS has so many issues, hasn't it? Which it probably does warrant an all-day meeting, to be quite honest with you. But whether you can get that in is another matter. Going through the nitty-gritty, yes, it's good that as much as I like Anthony, then we're only here from one side of it, aren't we? Why do we never ask somebody from the Royal College of Nursing, for example, to tell us about their issues? And we know that they've got them at the moment, otherwise they won't be on strike for the first time ever in England and Wales. Access to GPs, I think it's really, really bad that we classify GPs as to whether they can admit new patients or answer the phone, because we all know there's a huge shortage of GPs in the country. It's really unfair to classify.
Well, the GPs don't actually answer the phone; the receptionists do, and that's
perhaps
presumably
they've got staff shortages
absolutely.
and illness, like the people that can't come to our meetings.
That's right. They're dashing around.
Doesn't mean that the
GPs
are bad, does it? Doesn't mean the GPs are bad. I mean, as much as I like to see people come and talk to us, I had to pinch myself when this chap said that a 7% staff vacancy rate was an opportunity. It is not an opportunity. It's a failure. And it's also having huge problems. The fact that we can't get anybody from dentistry services is an indictment on dentistry services and the attitude towards the NHS. Haven't got a single NHS dentist in Beeston in 2 divisions of this county. Then we go on. July, before we're talking to East Midlands Ambulance Service performance. The problem is now, not in July.
We did have them recently.
Well, the problem is now. Things have changed, haven't they? Obviously, things have changed. Mental health services was last considered in February 2022 and it's not going to be considered again till July 2023.
We had the ambulance. Excuse me. At
sorry.
the last meeting, we had the ambulance people sitting over there, and they joined in with the winter pressures. I think I'm correct on that.
Sorry. No, but you've not been, because you two have been doing other work while people have been talking, because I've sat watching you, and so have we. You've been tip-tapping away, the both of you, writing notes. You're not interested, are you? No, I wasn't at the last meeting. And you're not at this meeting, are you? Because you're doing other things. You're doing other things. You're not interested in health
Just a minute.
scrutiny.
The meeting is still in progress. So
Right.
can we
I've
not
made my points.
Can we not accuse other people of what they've done or not done? All I'm saying is, at the last meeting, we had the hospital people there talking about the winter pressures, and they'd only been the month before. We had the ambulance people sitting over there, and we brought them together so that the ambulance people could discuss the winter pressures along with the hospital. Now, am I correct in that, other members who are here? Yes.
From my point of view, Madam Chair, and I was going to avoid saying this, but it appears that we're getting all the good news stuff and all the bad news stuff, and the challenges are being kicked down the line. Now, why is that?
I think I can tell you that we've had a lot of bad news stuff. Over the 18 months, whatever it is, since I took over this committee, we've had problems with the winter pressures, which were clearly explained. We've had problems with the ambulances, which were clearly explained. We've had the problems with the Bassett Law people who've had problems with their mental health. It's very rare that we come and get a good meeting like we've had today from New York Hospital. And if you remember, at the start of the meeting, I made that comment that it was good to come and have an agenda item that was actually good. So I think members would say...
But we could have had other things on today's agenda.
We could have done if you want to sit here till 3 o'clock.
Yeah. Because they're important. They're important to the people of Nottinghamshire.
The
fact that they can't get an ambulance and then they have to queue for hours outside
services
of emergency.
Do not make this meeting later than 1:30. So you're going right back to discussing with member services if you want this meeting to last all day.
Well, do that.
Well, what about the other people who've got other committees today?
Well, they're doing them here.
No, they're not doing them here. They're not in a committee while they're sitting here.
Let's
not have this argument, please. This is a health scrutiny meeting, and we're not having this argument. Councillor Pringle. I'm coming back to Nigel in a minute.
Thanks, Chairman. I think a lot of what's been said is we're actually on the same page here. I'm not sure that timing of a meeting should be an issue because of the critical situation that we find ourselves in. So I'd ask you to call an extraordinary meeting to actually frame some of the questions and the length of time that's possible, and that might be negated by who no can contact to get here actually to discuss. But I think it's important now because of the situation that we all recognise, and I'm not pointing fingers one way or another, but I recognise an issue. If we can scrutinise it, if it takes till 3 o'clock or 5 o'clock, we can have a break, coffee, a bit of snack or whatever. I think it's vitally important that we are able to scrutinise things at this moment in time.
Yeah.
So I ask you to call an extraordinary meeting according to who can attend.
Yeah, and I second that.
Can I just bring Nigel in because he's been waiting a long time?
We'll all agree that it is an issue. And as for being 8th on the list, well done, because I think we start at 20 odd in Bassett Law. So it is a major issue for many residents throughout the county. I'd like to know how, as a committee, we are going to influence these GP surgeries.
Absolutely, which is what I referred to.
It's a simple question. I'm sure the answer's not simple.
No, I think you're right. Councillor Welsh.
Right, my suggestion is the same with dentistry as it is with GP surgeries. You contact NHS England. We've done exactly the same with maternity departments, and now they are heavily involved in what is happening. If dentistry can't come back to the Health Scrutiny Committee, which is legally bound, and again, it's the only thing, then write to them. Again, I will sign the letter, write to NHS England and say, anecdotally, we've been told that people can't access an NHS dentist in Nottinghamshire. Therefore, we have requested this information and we have not got it, and we're unable to get an appointment. It is not good enough just to say, well, they never answer their email and they're not going to get in touch. Take it to the higher person. Take it to the higher person. With regards to GP surgeries, again, let's contact NHS England about it. If they can't come and tell us,
I haven't said at any time they have not answered their email, because I wouldn't know whether they've answered their email or not. I would assume, like anybody else, if they're sent an email, they have the courtesy to answer it. But I'm going to pass to the officer who can explain. But can we remember, please, that we're in a health scrutiny committee and we should not be shouting over each other and falling out with each other over what should be and what shouldn't be.
I agree, Councillor Saddington, and I would just hasten to add, I think Health Scrutiny continues to do amazing work, and none more so than, and I know I talk about it a lot because I feel passionately about it and I'm involved in it, but none more so than what has been done with regards to the maternity, because I wholeheartedly believe that without this committee doing the work that it did, it wouldn't have got to the stage that it did. I wholeheartedly believe in it, and that is why, Councillor Saddington, I feel so passionate about those other things that are going on in the community, that actually this committee can make a difference. And it can make a difference from what you say, what Councillor Adams says. I know Councillor Pringle super sub today, but you know, all of those people in all of those areas, when we talk about it, it makes a difference, and that's why I feel passionate about it, because it can make that difference.
Well, we've made the difference at Newark Hospital.
We've made a difference in the maternity department, but now there is such issues in all of our communities at the moment, and this is the only body that can ask those questions. And that's why I'm saying to you, is there a way that we can have an extra meeting? And I'm not just saying this, I've got plans, I have another job as well, but I would sit here, if you gave me a date, I would do everything possible to ensure that I could sit here all day if it meant that we could go through winter.
Let's bring the officer in, because he is the one that is negotiating these calendar issues.
Yeah, I'm aware we're in a public meeting, and I'm thinking as I'm speaking here, but in terms of the points that have been made today, and in terms of trying to find a way forward, here's a suggestion. I think in terms of dentistry, they have said they'll come to the March meeting. If we accept that and then look at our February meeting, we have Anthony May confirmed his availability isn't. He's got a lot on, as you well know. What I'm thinking is, if we were to have the meeting on the 21st of February to concentrate on winter pressures and maternity and nothing else, that I look to get an additional meeting in advance of the 21st of February in respect of access to GP services, and perhaps one other item, for instance, the colorectal, to see if we can get a date in advance of that, and that I go away and discuss with Scrutiny and Health and Children's how we can align our consideration of health visiting in Health Scrutiny with the other work that's going on within the wider programme, and report back separately on that, and look to get that looked at as soon as we possibly can as well, so that we're not either duplicating or running twin track approaches. So that's for me to take away and look to get. Now, I appreciate that means that we're not seeing the Chief Executive of NUH for several weeks, but by the same token, it does mean that we would be moving on the overall agenda of this committee at a faster pace, while recognising that there are restrictions as to how we can get through the business that must be done.
Can I just check something with I don't know, you really. If is it adult social care that's discussing health visitors as well as the children and young people? Because surely the adult social care has nothing whatsoever to do with the ages of 0 to
Yeah.
2.5.
If I could, sorry,
Is that wrong?
if I could bring in Martin Elliott, who
Yeah.
in
Can you
his other position is senior scrutiny lead, and he'd be able to explain the approach being taken.
can you just
Yeah.
clarify that?
Yeah.
Because if it's adult social care doing the health visiting, they won't have anything to do with 0 to 2.5-year-olds,
Yeah,
will they?
it's just give a little bit of context. Back in the December meeting of the Adult Social Care and Public Health Committee, we had an item on public health outcomes. The whole idea of that was to then enable that committee to focus its activity on certain areas. We came up with about 3 or 4. One of those was the 0 to 19 health programme. Now, it is one of these strange things because of how public health provision has evolved over time. The commissioning of it sits in adults, but obviously because of the service users, it does obviously it impacts children. So that was highlighted as an area for scrutiny. So last week, myself, the chair and vice chair of adults, and the chair and vice chair of children's met with officers about the 0 to 19 programme. So we're going to take a 2-pronged approach to it. So we'll have a pre-decision meeting in advance of the cabinet decision, and all adults and children scrutiny members will be invited to that. That will just be on the actual commissioning process. Once that's then happened, the commissioning process is going to run for 6-7 months. It's going to be quite a lengthy programme, so we're going to do a review that follows that work in tandem. And obviously, health visiting then can be part of that. That can be subject of that part of that work, because obviously it's such a massive thing. Scrutiny can't look at all aspects of it, but obviously health visiting can be one of them. But it is slightly strange where it sits. There's a few things across the council that sit like that, but it's commissioned by adults, but it is a service for children because it's a public health
I think I'm
service,
correct
really.
that at least 2 members of this committee sit on the children and young
Yes,
people's
yeah,
committee, so presumably they can have an input in any
yes,
event
yeah,
into the children part of
yeah.
this body.
It'll be a joint work because obviously it's in adults, but it affects children. So all members will be able to speak on everything that's as part of that review.
So Councillor Anderson and Councillor Welch, you will have an opportunity at that scrutiny of the joint one to put together. But it is a fact that when we can't overlap, but I can't see who will be looking at 0 to 2.5 other than us. And so I'm not sure that we can't go ahead with that for any reason.
Yeah.
And perhaps Noel can find that out.
The 0 to 2.5, 0 to 3 actually, is a statutory element of health visiting which is very separate to anything else.
So that's what I'm
has
saying.
Very, very clear government targets around that. And actually, if you look at the government information with regards to this and guidance, it is very clear as that element has to be kept very separate from everything else, separate to the nice healthy eating programs that health visitors do and everything else that they do in Gedling. It is very, very very separate for a number of reasons. One, because it plays such a huge role in safeguarding, a huge role in like Councillor Eddie just said. She had her assessments over the phone. Okay, and she's on the phone. Can your child pull itself up? So the so and so mum doesn't want it. Oh yeah. Elvis doesn't know that. And not only that, the amount of women now, the majority of the women still being seen by health visitors in that 0 to 3 gap, are women that have had babies in lockdown, which is nationally recognised as one of the worst times ever to have a baby. When I didn't get a health visitor appointment actually until he had his 2.5-year assessment. There's something fundamentally different there, Councillor Sannington. And the reason I know that you will definitely understand this is, in light of the pandemic and how women and babies are impacted, and there are quite a lot of reports out there because they're getting the actual real data of how children have been affected during the pandemic and going to school with language problems, etc. Given that, and given our situations within our maternity department, and the fact that we're talking about 6 or 7 months for a commission, etc., we should be looking at health visiting sooner than that, and we can do it as a government statutory guidance from 0 to 3 years old, and that will not affect anything, and that is purely health. It is a health, it sits under the Department for Health in the government, does not sit under children's or education, it sits under the Department for Health, and it's for very, very clear reasons, and that the government stipulates that.
Martin, can I just check with you? The Health and Wellbeing Board don't cover that.
I'm not sure, and again, I don't want to, because this was all quite a new subject to me.
Let me say, Councillor Welsh, we've heard you out. We know what you are trying to say. We can't overlap with other committees. I think you understand that. If we're getting outside people in, which is what this committee does, we have to go with their availability. And you know yourself, if you look at your diary today for a meeting, you're probably looking at 3 or 4 weeks ahead for a particular date that corresponds with somebody else. We will do our best. That's all I can say. The February the 21st meeting will incorporate dentistry and Anthony May, and if not dentistry, maternity. Sorry,
Yes.
I'm getting the wrong end around. And so we do maternity and Anthony May, and if we can pull in a meeting before that, we will look at access to GP surgeries. Is everybody relatively happy about that? Yeah?
And just to say, I'll follow up this meeting with sort of a plan of action to members of the committee, just to say this is what we're looking to try to achieve between now and the end of March in terms of priorities and getting getting the right people here and availability if necessary for an additional meeting before the 21st of February.
And as continuation, Councillor Pringle, I think you should probably be super subbing on the next 2 meetings.
I think, apart from signing in blood, I think I'm a member of it.
So, since this has created some debate, can we have a show of hands that everybody is happy with the way forward that we're going to go? Yeah? We're going to try and put in a meeting before February, and that we're going to continue with the February meeting as per se. Okay? Haven't had a reaction from, Councillor Welsh has just said. Okay, so with that, sorry, I can't hear you. You need to speak.
Thank you. Sorry, I just want to say something about. Cheers, Michelle. I just want to say something about the decorum of this meeting. This meeting has always been a meeting of mutual respect between political parties. There's no politics in it. And although the meeting can deal with some issues that are dealt with on a national level, we are here to understand better the health services of this shire and deal with them, not to personally attack councillors for things that other councillors don't understand what is happening on said computers or otherwise. And I would like to say that is a really sad situation that's happened, and you've brought this to this committee, because in previous, I'm talking. In other committees,
just a minute, Councillor Adams is speaking. Councillor Carl. Excuse me. Councillor Adams is speaking. Councillor Adams.
Thank you. And we do have devices in meetings, and we use them for making notes, and we use them for researching points that are raised within these meetings, specifically technicalities that we're not all trained in health services, and maybe some of the technical terms are not understood by us. But I would just like to appeal to all councillors in this meeting to return to that previous way of running this meeting, because we're dealing with very serious issues that affect a lot of people within our shire, a lot of people with serious worries about their lives. And I think petty squabbles about what people are or aren't doing on their machines is neither relevant or important in this meeting. And I would ask and appeal to all, including those that raised them, that we move back to that and focus on the important issues of this shire. Thank you.
I agree entirely with you, Councillor Adams, and I think we have been asked not to use paper. I use paper because I need to read things, but the 2 people concerned don't even have paperwork in front of them. So if they want to write notes, they've got to write it on a laptop. So I agree totally with Councillor Adams. This has been a very pleasant committee up until today to be sitting on. And I would agree with him entirely and thank him for his comments, in so much as we've got so much work to do in this committee. There aren't possibilities of squabblings between parties. It is not a political meeting. I have stressed that before. We are here for one reason only, and that's for the benefit of the Nottinghamshire residents we represent. We are not here politically, and we're not here to squabble over politics. The people out there who are sick want us to deal with the issues in the best possible way that we can. They do not want to sit at home watching on YouTube councillors squabbling over politics. If members have got issues to raise, such as Councillor Wells over things she'd like to see on the work programme, then I am more than happy to hear what she's requesting. No, I'm not saying anything. I'm saying if you've got things that you'd like to raise on the work programme, I am very happy to try and include them in one way or another. There is no politics with this committee whatsoever. And if Councillor Welsh or anybody else wants to include something, I am here for you to ask me to do it. And as far as I can, I will include your requests. And I think you know that. And as you say, it is through what we did that maternity is where it is today. And it is what we have done with Newark Hospital that the good committee report has come out today. So thank you to all of you. Councillor Carr.
Just very briefly, I don't think I've made a party political comment at all today.
No, you criticise people writing on laptops, which they're perfect.
Why is that a party political comment?
I haven't said it's political.
Well, the gentleman over there has said that. I have not mentioned politics. I could have done, because this is a health committee. How much more political can you get than health? But I haven't.
Well, it's a good job, because we don't discuss politics.
Well, of course you don't discuss politics, because it's too embarrassing for you at the moment.
It's not embarrassing for me. It's not embarrassing for me. And if they need to write on their laptops notes that that they need to record, they're perfectly able to use their laptops. That's what we're asked to do. I have not accused you of being political. Well, I haven't, and I'm chairing this meeting. Thank you very much. We'll see you at least on February the 21st, and if we can arrange a meeting prior to that, we will do so. All right? Thank you very much, everybody. Could we turn the YouTube off, please?